Hello, class. I've been having some technical difficulties. Had to use my phone this time, so hope it works this time. Okay, so I'm doing autism for this week's assignment. Autism spectrum disorder has gained recognition over the past 20 years. There have been many studies and theories made to explain what autism is and how it came to be. So, what exactly is autism? And what are the causes of autism? What are the noticeable behaviors of autism? And finally, what are the treatments for autism? So they don't really know what causes autism. There's been many studies done, but they haven't really pinpoint what it is. Um, According to neurolaunch.com in 2024, the editorial staff wrote that autism, from a neurological perspective, is atypical patterns of neural connectivity and information processing. Um, they go in to describe that the brain's activity in autistic individuals as having hyperconnectivity and hypoconnectivity in various brain regions. Dawson in 2022 said that the neurodiversity perspective claims that doctors are using autism biomarkers based on eye contact, um, bear with me, electroencephalography and magnetic resonance imaging to find autism in infants long before a diagnosis is made. Because normally, a child with autism actually doesn't get the full diagnosis usually until around 3 or 4 years old, unless they have very severe autism. The CDC, Center for Disease Control, said 1 in 36 8-year-olds are diagnosed with autism each year. But in their study, they found that that there is a lower rate of white children being diagnosed now compared to other races. They believe this is because the awareness for autism is out there, it's widely known, so now other races are now finding out that their children also have autism. All right, the CDC's findings are based on a 22 data collected from its Autism and Developmental Disability Monitoring Network, which spans across several states. All right, so the exact cause of autism is not known. However, there have been several theories. The Mayo Clinic had some theories. They include Fragile X syndrome, which is an inherited gene that causes intellectual problems. And here's another one: tuberous sclerosis, a condition where benign tumors develop in the brain. And finally, Rett syndrome. Rett syndrome causes the slowing of the head growth, intellectual disabilities, and loss of hand use. However, for Rett's disorder, it is mostly found in females. And then, if you know anything about autism, autism is more more male directed. Yes, females do get autism, but it's at a higher rate for males, and they don't know why. Wakefield and Associates claimed that the measles, mumps, and rubella MMR vaccine was linked to autism. However, that link has now been disputed. It is not the case. Then there was another theory that I'm going to try it, thimerosal, which is a preventative used in vaccines. Though there was no link, that was they never could prove that link, but on the safe side, they stopped using it in the vaccines. Now, for the behaviors of autism, please note that not every kid shows the same symptoms. Some of those include fails to respond to his or her name, has poor eye contact, speaks with an abnormal tone or rhythm, repeats words or phrases but does not understand how to use them, does not express emotions, and has a routine and becomes agitated when that routine is disrupted. Now, I chose autism because I have a personal connection to it, where I have two boys that were diagnosed, one on each end of the spectrum. And I will say for my oldest, who was on the lower end, he was diagnosed pretty young, um, and for him, he just he had no emotion whatsoever. He could not play with other children. He would hit. Um, he would just act out in anger constantly, and so at first he got the diagnosis of bipolar, but that was then later changed to autism, especially when he wasn't talking at the age of 7. And they even, in his school, when he was 7, because I would have to go to school with him to translate for him because he was trying to talk, but he could not pronounce words correctly. So finally, they came up with a computer system where he had a keyboard and it would talk for him, kind of like oh, I can't think of that famous guy now that had one. I can't remember. But anyway, it was a computer that when he would type it out, it would say what he was saying. And then I could finally not go to school with him anymore. All right, so according to the neurodiversity perspective, some behaviors like self-simulating simulatory behaviors have been found to be a self-regulation function. Um, for this one, the example used is rocking back and forth. Yeah, it calms them. It All right. So autism is pragmatic in 3 areas: communication, social interaction, and behaviors. Those with autism tend to have higher rates of anxiety and depression. So now the treatment for autism is geared mostly towards behavior and communication. Um, there is occupational therapy. Occupational therapy works with sensory disorders. All autistic kids have sensory disorders. Certain textures, touches, they will not eat or they will not touch, or I mean, it just drives them crazy. So with occupational therapy, they work with kids. What they do is they take them out of their comfort zone and get them used to the different textures, and that in end will help does help with behavioral issues. Speech therapy is used obviously to help them communicate better, help them pronounce words more effectively so others can understand them. And then also family counseling. Now, family counseling is a very good idea because if you don't know anything about autism, going to family counseling is a good idea because the counselor, if you find a counselor that knows about autism, um, or specializes in autism like I did, they tell you what behaviors to look out for, how to handle those behaviors to where you're not constantly yelling and screaming at the kid because it is very hard to deal with an autistic child. But they teach you how to do it in a positive way so that the child can get self-esteem and a good self-concept. The but as I was reading in my research, the neurodiversity perspective does pose a interesting question. They say to consider whether the purpose of prevention or losing the autistic diagnosis, because in their view, doing all of the different therapies and all that go with autism um, could cause the child to lose the diagnosis um, through the early interventions. They wonder if it's really because autistic traits are stigmatizing in society that fails to accept neurodiversity. And if so, then maybe society needs to change and not the autistic kid. Having raised kids, that's a good question. They make a good point. But when you have school age children and the other kids are seeing that they act different, behave differently, talk differently, play differently. I mean, everything's different. Um, those early interventions really do help them to uh, really prevent bullying and it helps them to make friends. Uh, so there's something to think about. All right, so that is my post for this week's assignment. Sorry it's really late, but I was having technical difficulties. So, y'all have a blessed day.